Welcome back to our Korean beauty breakdown of Asian rhinoplasty in Korea. In our last video, we did a quick overview about common concerns regarding Asian nose surgery. We're here to talk about specific methods and materials used for the procedure itself. It's always good to be well informed about your health and beauty options to help you make the right decision to achieve quality results. I'm Jeet, founder of My Seoul Secret, and I'm here with Dr. Kim, rhinoplasty and facial contouring specialist at Deesse Plastic Surgery here in Seoul, Korea.
Welcome back everyone, I'm Dr. Kim.
This is our second video on Asian rhinoplasty, so be sure to watch the first one if you haven't. You can find links to other videos in our description below. One of the most confusing choices for patients is which technique they should choose for their surgery to get the best results. What's your take on this?
There is no simple answer to this question. All surgeons have their own style and preferred techniques to solve a problem. But let's start with the basic, which is having either an open or a closed rhinoplasty.
Can you elaborate on this?
An open procedure is literally just like it sounds. An incision is made to expose what's underneath your nose to have an open view of what's going on. The incision is made across your columellar, which is the soft tissue that separates the nostrils. The advantage of this technique is it gives the surgeon easy access and better view of your nose for more precision and accuracy. The drawback is the healing time is longer and the small scar will remain underneath your columellar, but it will fade with time. The open method is better if you had nose surgery before or for more complex cases.
Got it. And is closed rhinoplasty then just like it sounds?
Yes, in this approach, the incisions are done within the nostril, so they are more hidden. The surgeon does not fully expose the nose to see what's underneath, but instead, he operates within the small nostril incisions. The advantages are shorter operating time, no external scar, and less swelling on tip. The advantage is that it can be used for more complex cases.
So it sounds like open rhinoplasty is like fixing a car engine with the hood open, and closed rhinoplasty is like trying to fix it with the hood slightly open.
Yes, that's a good example.
So then how would you know which approach is best?
Personally, I prefer open rhinoplasty because it is applied in various cases. Many surgeons accept open rhinoplasty as a standard technique over the world. But in general cases, your surgeon will recommend the technique they feel is the best for you, and this depends on the goals both you and your surgeon decide before surgery. Some surgeons perform exclusively open or closed techniques, and some do both. So if you have a preference, be sure to ask and discuss this with your surgeon. And the skill of your surgeon is the most important factor in achieving good results.
That's right. And Dr. Kim has many years of experience performing rhinoplasty. So just a reminder, if you have any questions about your nose surgery, leave them in our comment section below. So far, we've covered two main techniques. Dr. Kim, can you tell us about the different materials used in rhinoplasty?
Sure, Jeet. The materials used for rhinoplasty may involve implants or using your own body tissue to create predetermined shapes known as grafts. These grafts serve different purposes. Some are for structure and stability, and others are for shape and form.
Where do grafts come from?
They can come from your ear or nasal septum, which is the cartilage that divides the two sides of your nose, as well as your rib cartilage. Ear cartilage tends to be used for tip area, and also septal cartilage can be used for the tip, but also to help shape the bridge. Whereas rib cartilage is an option if there's not enough septal cartilage or to increase the nasal bridge height without using an artificial implant.
Speaking of implants, what types are used in rhinoplasty?
Implants are used for the bridge height and the shape. Again, you can use your own body's materials such as your rib cartilage as well as connective skin tissue from another area, such as your scalp or glutes. Using your own tissue can create a natural look and feel since it comes from your own body, but it may be difficult to control your precise shaping. Using artificial implants like silicone and Goretext are easier to create more predictable shape. Silicone is the most commonly used in Asian patients since it can create more pronounced shape. Goretext implants allow for better stability since tissue can grow into the implant and the result may look more natural and less pronounced than silicone.
So far, we've covered Asian rhinoplasty and the common methods and materials used. Thanks for sticking with us this far. We're halfway through our series, and up next, we're going to be talking about non-invasive methods to change the shape of your nose. Now, we'd love to hear your feedback about this video or suggestions for other video topics, so feel free to ask any questions you might have so we can help you get the answers you're looking for.
And also subscribe to our channel to get more information about beauty treatments in Korea.